unions have accused the Health Secretary of being afraid to debate the issues raised by the new contract. They accuse him of forcing this one down their throats. We go to Westminster and the Health Secretary, Jeremy Hunt, is there with us this morning. Good morning to you, Secretary of State.
Good morning, Eamon.
Now, somebody could die today. If so, you've got to take some of the responsibility, haven't you?
Well, the people who are responsible for what is happening today are the people who are choosing to strike. Striking, withdrawing emergency care, as you say, for the first time in NHS history is a choice. And all I would say is that we have had huge discussions over how we deliver a 7-day NHS. We've been having them now for over 3 years. We've had 75 meetings, but you can disagree with what the government's trying to do. We say that you can't choose which day of the week you're ill, and that's why we want to promise every NHS patient.
In fairness, Secretary of State, they're saying you're trying to deliver a 7-day NHS with 5-day resources.
Yes, well, that's not true, because this year we're actually putting into the NHS the 6th biggest increase in funding in its history. But what we know is that if you're going to improve the NHS, it isn't just about money. It's also about making sure that care actually gets better for patients. And as I say, you can disagree with the government's vision for a 7-day NHS, but is it proportionate or appropriate to withdraw emergency care from vulnerable patients? Because that's what's happening today. The single issue that we couldn't agree on, where the deadlock was over Saturday pay. And we are offering doctors higher premium for Saturday pay than nurses, than paramedics, than the assistants who work in their own operating theatres. This is a very fair deal, and the question on many people's mind is, given that police officers and fire officers don't get any premium at all for working at the weekends.
Yeah, but you'll talk about this. They'll say there are 4 other outstanding issues. You keep talking about money, right? How much money are we talking about? How much money are you going to save by not paying them what they want on a Saturday, for instance?
Well, we are paying them more. What they're actually getting on a Saturday, depending on the time of day, is time and a third or time and a half. So we're not saying if you work regularly on a Saturday that we're not going to pay more. But the reality is that we can only pay them at levels that mean that we can afford to have proper medical cover at weekends.
Is
and
that
you
the
can't
reality?
choose which day of the week
People will be saying, of all the ways you could save money in the NHS, of all the people you could club, I mean, if you were going after the pharmaceutical companies who were making massive profits over medicines and things, people might say, well done. People don't want you to be clubbing doctors, do they?
Well, and we're not. And, as you know perfectly well, 75% of doctors will actually see their pay go up under the new contract. And the doctor's pay bill will not be going down, it'll be going up. But what we're saying is that, the first line on the first page of our manifesto was a 7-day NHS in the general election we had last year. And that is because, if we are going to offer high-quality care in the NHS, we want to be able to promise every patient that it doesn't matter which day of the week you get ill. You can't control that, but you can be confident of the same high-quality care from your NHS. That's something that's overwhelmingly supported by the public. But we have a duty now to deliver that manifesto promise, and no union, however powerful, however popular, has a right to veto a manifesto promise that the British people have voted for.
So this is not about money, this is not about principle, this is not about medicine, this is about politics now. This is about some manifesto that you've had. I mean, this is you against the unions then.
Well, I'm sorry, but you can't dismiss a manifesto and say it's just about politics. A manifesto
is
what...
Made it political.
Let me answer the question.
Very political
a manifesto
now.
is what political parties promise before elections. And what would you be saying to me in a year's time or 2 years' time if I was on this programme and I said, I'm really sorry, I didn't deliver what we promised in our manifesto because it was a little bit difficult at the time and the doctors' union didn't like it? You would accept that. You'd say you made a promise to the British people. Now, we made this promise for a 7-day NHS, and we have a duty
if
to deliver
properly funded, I suppose. But you see, Health Secretary...
And as I said to you, we're putting huge amounts of extra money. No, Damon, there's £3.8 billion of extra funding going into the NHS this year. But I have met too many patients who've told me heartbreaking stories of tragedies that they and their families have suffered because they didn't get the care that they needed at weekends.
But you've nothing to prove that having more doctors on at the weekend would stop that.
The highest quality system in the world.
Where's your studies that say having more junior doctors at the weekend would stop that? I mean, you have to have the ancillary services as well.
Exactly, and that's what I said in my statement yesterday, that this isn't just about junior doctors, it's about consultants, it's about 7-day diagnostic services, it's about 7-day access to the social care system, it's about 7-day GP services, it's about a whole range of services to make sure that NHS patients can be confident about the care they get at weekends.
We're heading towards the break. Just some concern about you. Are you running the show still? Are you still in charge here? The fact that we're talking about politics, are you being told what to do by the Prime Minister, or is this your ball game?
The Prime Minister and I are absolutely at one that our solemn responsibility is to deliver what we promised to the British people we would do, and that is a 7-day NHS so that they can be confident in their NHS care every day of the week.
Health Secretary, thank you for your time this morning. We're now just over half an hour away from this all-out strike. I appreciate your time. Thank you. We have to leave it there. Thank you very much indeed. That's the Secretary of State for Health, Jeremy Hunt. This is Sky News Sunrise on a Tuesday. Back after this.